Well, hello and welcome to this session on advanced care planning. My name's Anne Meller and I'm a nurse consultant at Prince of Wales Hospital. I'll just pull up the slides. So this is session 2 in a series of in-services for residential care on advanced care planning, but many of the terms correlate across acute, community, as well as residential care. So this is the second session. Last week I went through some context and background. Today I'll be covering the definitions, and if you're clear on the definitions, you're fairly well placed to go forth with your advanced care planning activities. Before I start, I'd like to acknowledge the traditional custodians of the lands on which we're all meeting. I'd like to acknowledge locally the Gadigal and Bidjigal people who are part of the Eora Nation. I extend my respects to elders, both past and present, and all Aboriginal people present today. So the definitions will be covering advanced care planning, an advanced care directive, an advanced care plan, enduring guardianship, therefore the difference between advanced care plans and advanced care directives, and what the validity requirements are for an advanced care directive in New South Wales. So what is advanced care planning? We probably all have our own definitions or what we think it is. The definitions I'll be providing today are from the National Framework for Advanced Care Planning documents. Now this was recently revised in 2021 from the original document, the Statutory Framework for Advanced Care Directives. That was developed in 2011. And the Advanced Care Planning framework goes through the iterative stages of advanced care planning, where we're having a discussion and then that might result in a document, either an advanced care plan or an advanced care directive, and then also what happens when we need to act on those wishes on those documents further down the track. So what is advanced care planning? I've got some slides here and it might be easier if you just go ahead and read them, but it's I think if you think clearly about the process, if we get the process right, we're well placed. It's not just about getting a form filled in or filling in a document and ticking a checklist. So if we think of the process of advanced care planning, it's around encouraging people to have a say in what their values, beliefs and preferences are that can guide decision making in the future when that person can no longer speak for themselves due to illness or injury. So what's an advanced care directive? So these are voluntary person-led documents that are completed and signed by a competent person that focuses on their values and preferences for future care decisions, including their preferred outcomes of care. They're either recognised by legislation, which makes them statutory, or common law, non-statutory. And they come into effect when an individual loses decision-making capacity. Given this is a national document, some states will have legislation, so they will have statutory documents, and other states won't have them for particular items, and so you'll go to common law for those items. But for every state, there is legislation that supports appointing someone to be a substitute decision maker. So a statutory advanced care directive is a document that's signed and it's in compliance with the requirements set out by the state's legislation. And in New South Wales, the Guardianship Act is the legislation that supports the appointment of a substitute decision maker. The National Framework also says as a definition that in an advanced care directive you can write your wishes or you can appoint someone. So both those documents are actually advanced care directives. In New South Wales, basically you have 3 opportunities or 3 avenues if you so wish to consider your own advanced care planning. You can appoint someone to make your decisions about your health and lifestyle, and that person's called an enduring guardian. That is a statutory appointment in New South Wales. You can complete an advanced care directive, and that is according to common law requirements in New South Wales, or you can develop an advanced care plan to provide some guidance to those close to you. So if we talk first about appointing an enduring guardian. So I need to just, before I go on to enduring guardianships, I just want to clarify that enduring power of attorney isn't the same as enduring guardianship. It's a common misunderstanding. So power of attorney and enduring power of attorney relate to money. They relates to financial transactions, real estate, shares and assets. And that the person that you might appoint to make those decisions or make those financial decisions for you, that's they only have that authority. They can't make your health care decisions just because they hold that power of attorney document. So an enduring power of attorney, there's a clause in the appointment that notes this appointment will continue in the event that I lose mental capacity. So if that clause is deleted, then the power of attorney ceases when I lose mental capacity. So enduring power of attorney, it's a separate appointment to enduring guardianship. If the clause isn't omitted, then it means the person can continue to act on your behalf in regard to your financial decisions only when you lose decision-making ability. So enduring guardianship, enduring guardians can make decisions. They're called functions. You can appoint one or more guardians. You can give them specific functions. They can act together or separately. You can appoint a primary and an alternative guardian, and you can give them specifications about how to act or what to consider. And some people put directions into their appointment about the use of life-sustaining treatment in the event that they're towards the end of their life. So the individual and the guardian sign that, but that's got to be in the presence of an eligible witness, and that person is not a JP. It's someone who has a recognised legal, they're a prescribed witness. They're either a solicitor or a clerk of the court or a local magistrate. So the types of decisions that guardians can make, they can decide where you live, what healthcare you receive, what services you should receive, and they can give or withhold consent to medical treatment on your behalf. They're the main ones. Guardians can't make a will or alter one on your behalf. They can't vote or consent to marriage on your behalf, and they can't override your objection to treatment. They can't consent to special treatment. There's more information about special treatment and if you want to override someone's objections, on the New South Wales Civil Administration Tribunal Guardianship Division website. And they can't make decisions that are contrary to the law. What you might notice if you get a copy of someone's enduring guardianship appointment, sometimes they do include directions about what they want to happen at a certain point in their life. And I'll let you just read through what I often find in some documents. So within the directions, they say, yes, please consent to treatment. I'll have whatever's available to keep me well and healthy. Everything. However, if I'm in the terminal phase of an incurable or irreversible illness or in other situations, and these 4 clauses are quite common in many documents that are developed by solicitors. So if I meet criteria for one of those or all 4 of those situations, then my enduring guardians have the function of refusing medical treatment on my behalf, even if that treatment is necessary to prolong my life, and the refusal will lead to my death. And if that's the situation, they require that each of the guardians exercise his or her functions subject to the following directions. So if they're in one of those 4 situations, then they state what they do or do not want. So it's just really worth looking at those directions and seeing how and when they might apply. And they mightn't apply yet, they might apply further down the track. Or maybe they won't, you won't need to consider them at all. So this is the type of treatment that someone's refusing in the event that they meet reach a certain position. So directions are important. So that's enduring guardianship. I'll now just move on to an advanced care directive. So in New South Wales, we know practitioners require a valid consent. Capable patients have the right to refuse treatment and can do so in advance. And the Guardianship Act actually provides a mechanism for substitute consent for those people who can't provide their own consent to treatment. It's actually a safeguard for very vulnerable people. New South Wales Health has recently revised some of its documents, in particular the Consent to Medical and Healthcare Treatment Manual in 2020 and the End of Life Care and Decision Making Guideline that came out in 2021, and using resuscitation plans in end of life decisions. So policy documents are mandatory for health staff to follow. So the Consent to Medical and Healthcare Treatment Manual, it covers a lot in terms of consent. So some of the extracts that I have for you is around the refusal of treatment using an advanced care directive. So New South Wales Health goes on to describe for New South Wales what an advanced care directive is. I'll let you read that. And it's very clear a directive can only be done by somebody with decision-making capacity. A person responsible, including an enduring guardian, cannot complete an advanced care directive on behalf of somebody else. They can participate in advanced care planning discussions and they might develop a plan, but they're unable to complete an advanced care directive. Whatever they complete, that would be termed an advanced care plan. There's no standard form in New South Wales. However, New South Wales Health does have a document called Making an Advanced Care Directive, and you can download that from New South Wales Health's website. Advanced care directives shouldn't be confused with clinical care plans like treatment or resuscitation plans that are written by medical practitioners. Advanced care directives will guide and it will inform those resuscitation and treatment plans. So how do I know that an advanced care directive is valid? It basically has to meet 3 criteria. It needs to have been made voluntarily by an adult with capacity. It needs to be clear and unambiguous. And it was intended to apply to the situation at hand. I'll let you read this slide. So we can say an advanced care directive in New South Wales is valid and legally binding is a term that's used if documents have been presented before the courts. And in fact, in New South Wales, we've had 2 cases where documents have been presented to a judge and because they were valid, he upheld them. So we can say that if the document is valid, that it would be legally binding and health professionals should follow it. Of course, if you have any queries, you can always go to the New South Wales Guardianship Division for Civil Administration Tribunal or Supreme Court, or you can escalate that within your local health district to get advice. I'll now go on to advanced care plans. They tend to provide guidance. Again, this is back to the national definition. So it captures beliefs and values and preferences. The difference being that it might be done by someone who has capacity, that they just want to give some guidance about what sort of things to consider in terms of their care and preferences. But an advanced care plan might also be completed on behalf of someone who's not competent or no longer able to have a say in their own decision making. So the aim there is just to guide decision making. So advanced care plans are not legally binding. And basically, whatever bit of paper you get, it might have directive written on the top, or it might have plan written very clearly on the top. You need to look at it and go through it and just determine if it meets the criteria, regardless of what the heading says, for a directive. If it looks like it was done voluntarily by an adult with capacity, it was clear and unambiguous, and it does apply to the situation at hand, then it should be considered a directive. If, however, it's been done by others or done on behalf of the person, or it just provides some guidance, consider that a plan. Think about what you're doing now within your service. Do you think about enduring guardianship? Do you ask people is there an enduring or another guardian appointed for this person? Enduring guardianship's when I might want to appoint someone for my future. However, if I haven't appointed someone and decisions need to be made, there might need to be a tribunal hearing whereby there's a hearing and everybody's views are considered, and the tribunal might say we need to appoint the public guardian to be the decision maker for healthcare, or we need a private guardian, someone who can step up and can have some support in making decisions. If someone does have guardianship or advanced care directives, get a copy of that, put that on the file. In our health district, we can upload those and scan them electronically and hand over to other staff on each shift as you're continuing that care along with other resuscitation plans, etc. So think about your needs and perspectives from your point of view. Next session, I'll be going through processes within facility on admission, review and transfer. I'll probably cover the person responsible hierarchy, which is only used if someone's in relation to medical and dental consent. It doesn't apply to accommodation and other areas. So it's just around medical and dental consent. If you have any queries in the meantime, feel free to email me. So thanks for joining me. See you next week.